Hi, I'm Rebecca Mostaleski, midwife and compression director with Motif Medical, and today we're going to talk about how long you should wear your compression garments. Let's start by talking about compression socks. The short answer to that is wear your compression socks all day long. I'm going to go into a couple different scenarios that you might be wearing compression socks. First, if you're wearing your compression socks because you have varicose veins or you have swelling at the end of the day because you're on your feet a lot or you're sitting down a lot, then really the best answer is just to wear your compression socks all day long. Put them on before you get out of bed in the morning and wear them all through the day until you're ready to sit down and prop your feet up at night. If you're wearing your compression socks because you're traveling, and a lot of pregnant people are more prone to swelling while they're traveling, whether that's by car or by airplane, then put your compression socks on before you start your travels and take them off when you're done with your travels. If you're wearing compression socks because you're going for a hike or you know you're going to be walking a lot in one particular day, then put your socks on before you go for your hike or start walking, and then wear them throughout the whole time until you're done and take them off at the end of your hike or your walk. One thing that compression socks are really great for is avoiding the swelling that can accumulate over time. So if you're prone to swelling, if you're going to be traveling, any of those things, if you work a desk job and you're sitting a lot, make sure you're getting up every 30 minutes or so to walk around. The compression socks are going to help, and they do help improve circulation, but your movement is going to help a lot with that as well. So next, let's talk about pregnancy compression, that maternity support band. I like this to be used a lot more infrequently depending on your particular circumstances and your job. Really what you want that pregnancy compression to do is support your core in the work that it's doing every day, but you don't want it to take the place of your muscles. So you want those muscles to still be working like they normally would. The compression belt is just to reinforce them and give them a hand in the work that they're doing. So how long should you wear it? Well, I would say to wear it when you're exercising, if you know you're going to be on your feet for a long period of time. Sometimes the discomforts that come during exercise and pregnancy will keep people from being active, and I don't want that to happen. I want you to stay active and stay in shape and keep up an exercise routine all the way up through delivery, and a pregnancy support belt can really help with that. It'll just stabilize your pelvis, reinforce your core, your back, your abs, and allow you to continue that active lifestyle. So the postpartum compression garment is great for any time after delivery. You can put it on right after you've had the baby if you want to. It's going to help your uterus clamp down and slow your bleeding. It's also going to stabilize your core and pelvis again in the postpartum. All of those muscles have worked really hard throughout pregnancy and during your delivery, and it's going to give you additional stability as you're sitting or moving around. Ideally, you're taking it really easy in those first couple of weeks. I always tell my clients that all I really want them to do for the first 2 weeks is to rest and feed their baby. So I'm not talking about getting up and doing any sort of housework or exercising or anything like that. But wearing that compression garment all day long if you want to is totally fine. Just take it off when you're sleeping at night because there's really no reason for you to wear it then. You might find, if you haven't worn your compression garment from immediately after delivery, that whenever you put it on, your discharge increases a little bit. And that's pretty normal and to be expected because it does help your uterus to clamp down. It's just giving a little bit of extra compression from the outside that's going to make your uterus more effective, and your discharge may increase. It should not go back to being a heavy flow like it was in the first couple of days postpartum, but if you do notice a slight increase, it's just the work of the compression garment. As you start feeling better postpartum, a postpartum compression garment is a great thing to wear as you do start getting up and moving around the house. Again, it's going to give you extra stability, and it's really going to help you maintain good posture. The lifestyle habits that we have really make an impact on our core muscles and how they function. And there's a little bit of relearning that goes on after the baby is born as your body's developing new habits and movement patterns. Wearing a compression garment will help you move correctly because it's going to hold everything in place where you want it to be as you do return to your daily lifestyle. Thanks so much for watching. I hope this has been informational. Please let us know if you have any questions, and you can always find more information over at motifmedical.com.